Welcome to the equipment module. Today we will be discussing different medical devices, equipment, and assistive technology that you may see at different sporting and recreation events. According to the Assistive Technology Act of 1988, an assistive technology device is any item, piece of equipment, or product system that, whether obtained commercially, off the shelf, modified, or customized, is there to help someone increase, maintain, or improve functional capabilities, that individual having a disability. So some of the more medical devices that you may see at these events that volunteers need to keep an eye on are things like catheters. Catheters are any flexible tube or insertion into the body, but for individuals with sporting and recreation backgrounds, you usually see a urinary catheter help to drain the bladder when the bladder isn't working properly. These insert into the urethra and generally have a balloon that inflates. So it's very important not to pull, tug, or kink the catheter, or that could lead to damage to the bladder, damage to the urethra, or in someone with a spinal cord injury, kick off an episode of autonomic dysreflexia. Other things that you might find with individuals are colostomy bags. This is where you would essentially cut the colon in half and bring that colon to the abdomen, forming a stoma. And that's where that individual would defecate. And there's a bag that forms around the outside. If that bag were to burst or dislodge, that could stop the individual from having a good time at their sport and recreation event and in their day very quickly. Also, it could become infected, so volunteers may be asked to carry different bags or assist with urinary drainage or changing out the colostomy bag. Other things that we generally see as far as mobility assistive devices are crutches, canes, and walkers. Canes, there's generally a couple of different types of tips. This would be considered a standard J cane, usually for individuals that don't require that much assistance with mobility or balance. They come in adjustable heights to fit for the individual. They're fairly cheap and they're fairly easy to use. You can see individuals that utilize a cane more so on a day-to-day basis will have a functional grip cane that's able to distribute the forces through the hand and wrist a little bit easier. Crutches, again, very easy to use. Most people use them incorrectly. This is known as an axillary crutch. It comes with a pad that's supposed to sit just below the armpit, and it comes with a platform for the hand. Most individuals lie on their crutch, and that can create some disruption in the axilla or the armpit. You're supposed to take about 80% of the weight through the wrist and the hand. There's 4 types of crutches that you may see. This is a normal axillary crutch. There are also what's called elbow, loft strand, or Canadian crutches. You'll hear them at all different names. And those are the crutches that fit around the forearm. They don't extend above the elbow. Take a little bit more trunk control and arm strength to use, generally a little bit more energy. We also have gutter crutches, where if an individual can't bear weight through their hands and wrists, they bear weight through the arms. It's just a gutter that goes underneath with the crutch that extends to the ground. We also have a knee crutch, where they try to take away your upper extremity use and just flex the knee and put the crutch from the knee down to the ground. We also will see individuals utilizing walkers. There's 3 common types of walkers. This would be a standard walker. It has 4 legs, no wheels, takes a little bit of strength and a little bit of balance to move from step to step, generally used indoors and over even terrain. Can see that it folds up and the legs are adjustable for different heights. We also have rolling walkers that replace these 2 front legs with wheels, and we have rollators. The rollator generally has 4 or 3 wheels, has hand brakes, and has a seating system. So if the individual gets fatigued, they can put the seat down, put the backrest bar down, pull their brakes down, and be able to rest and gain their strength back. Unlike prosthetics that are used to replace a body part, orthotics are used to support. So the definition of an orthotic is an externally applied device that is used to support, align, prevent, or promote motion at a mobile body segment. There are 2 general types of orthotics that we can think about. There are static or fixed orthotics, like this solid ankle AFO. Those are used to prevent motion to allow healing or to prevent further deformity. We also have dynamic orthotics, and those promote movement in certain directions while preventing movement in other directions. It's important to think about orthotics as a global piece of assistive technology where it's not just for the feet, the ankles, the hands, the wrist, but we can also have spinal orthotics, anything that would be utilized to support the body. When we think about them in regards to sport and recreation activities, we need to know that some orthotics can be removed prior to the start of participation, like skiing. If we had an individual that was wearing an ankle-foot orthosis and we couldn't fit that into the ski boot, we know that the ski boot provides the same amount of stability as the orthosis for that event. And we would take the individual out of the orthosis and allow them to gain that support from the ski boot. It is important, if you are going to remove an orthotic device from an individual prior to participation, that you know where you have placed it so that then when they return, they can get it back.
This is a basic manual wheelchair, primarily used to transport participants on flat, hard surfaces such as cement or pavement. A few things to consider when transferring an individual in or out of the device is making sure the wheels are in a locked position, the footrests are out of the way, the anti-tippers in the back are down in a locked position, and if the wheelchair has a seat belt, make sure it is buckled. Once a participant is in the wheelchair and you start maneuvering them around the event, it is important to consider that you do not run into any obstructions or soft surfaces. If you do, try to take another route or ask for assistance from another volunteer. There are a lot of ways to maneuver a power wheelchair. One of the most common is by joystick. Whenever an individual is transferring in or out of the device, make sure the wheelchair is turned off on the actual controller itself. It is important that the device be turned off when the person is not driving. It is even more important that the device be turned off when the person is being transferred in or out of it. The chair's motors can be unlatched and turned off so the chair can be freely maneuverable. The volunteers are not advised to do this unless they have proper training.
In general terms, we can think about a prosthetic as a replacement for a body part. Today, Lance is going to tell us a little bit about his different types of prostheses for his upper and lower extremity and go into a little bit of the componentry for you.
Well, Justin, I'm wearing a carbon fiber foot, a rotator on top of that foot, a microprocessor knee, and a suction liner, carbon fiber suction liner. For the upper extremity, I have a body-powered carbon fiber upper extremity prosthesis. And to move that prosthesis, I use scapular abduction and humeral flexion to move the prosthesis.
Excellent. Now, what are some of the things that a volunteer could help you with your prostheses during a sporting or recreation event?
Well, during a sporting event, I usually take off my arm so I could have full range of motion swinging my arms without hurting myself.
That'll do it.
So they could watch my arm for me, they could take it and put it in a safe place for me. Now, sometimes the leg might come off. It has happened before, and what they could do is to help me get it back on. I can usually get it back on myself, but I'd like maybe need somebody to stabilize me while I'm standing there doing it.
Mm-hmm. Now, when the leg shrinks up your residual limb and it gets a little bit loose, what do you do to combat that?
Well, after a few hours of being inside the socket, you start pumping a lot of fluid out of your residual limb. So we have prosthetic socks that you can apply to make up for that volume and keep that socket nice and tight.
And do you ever have the volunteers hold on to those for you?
I do, and they hold on to all my extra bag of goodies, let's say, so that I have ease of access to them.
Great. Thank you, Lance.
You're welcome.
Lee, we have your current manual wheelchair here with us and some accessories that you're able to bring. Would you like to go into that a little bit more?
Yes, this is my ultra lightweight wheelchair, everyday use. You can tell it has a cushion on it specific for me, help me with weight distribution, pressure sores like that. Central part of the chair, definitely. We have a hard backrest on the back. Just regular push rims. This chair is designed specifically for me.
Wonderful. And then you see you have a wheel here. Would you like to go in a little bit more detail about what that does?
Yeah, this is an extra attachment that I use when out maybe in the yard or something. As you can see, it just kind of clamps right on the front perfectly. Takes those front wheels off the ground a little bit. They can get caught easily in mud and dirt, you know, when I'm trying to do maybe a trail or just work in the yard. So this is a great piece just to be able to get out a little bit and off the terrain.
Yeah, definitely. Definitely essential whenever you're on some kind of uneven terrain at one of these sports or recreational events. Is there anything that you'd like the volunteers to know about your current chair whenever you transfer out of it, or anything more specific when you're at one of these sports or recreational events?
Yeah, absolutely. One of the crucial pieces is making sure that you let me know where you've put my manual chair as I am competing, just so I know later on where it is and can maybe tell another volunteer if that volunteer isn't there. Also protecting it from any elements. If I'm in something that's an outdoor event, protecting the seat from getting wet or getting lost in any way, because they can come off fairly easy. So letting me know that this is very essential in allowing me to participate. You know, this protects my skin, protects me from any pressure sores. I want to be able to get out in the community and I want to be able to do the activities that I enjoy. So keeping my chair intact is very important.
Wonderful. Thank you very much.
You're very welcome.